Thanks, Brad. So we're going to have some morning sessions on open data. And as some know, and Jay actually alluded to it, open data these days, it's not just a fanciful concept, it's actually the law of the land, at least for federal agencies, which is to say that President Obama, a couple weeks ago, signed in a federal, federal executive order that essentially makes data that's available from federal agencies, it has to be made available in machine-readable format. So this, in essence, means no more paper files, no more PDFs, at least from the federal agencies. And their goal, as they said in the executive order, is to fuel innovation and economic growth. So let's kick off our first panel. And to moderate our first panel on open data, I want to bring in one of the experts and pioneers here locally in open data, and that's Steve Spiker, Director of Research and Technology at the Urban Strategies in Oakland. Steve is really an open data warrior here, one of the guiding lights in California regarding open data, been very active locally in terms of open data, and really done a lot in Oakland and in Alameda County to ensure that data are being used effectively. So take it away, Steve.
Good morning. You all have enough caffeine? Not quite, not quite. Okay. Like Jay, I've got a 14-month-old, and I didn't sleep much last night. So luckily, I'm not doing the hard talking today. So if I fall asleep on the couch, it's because you two are very convincing, not because I'm bored. So we're at a very exciting place right now in California and in the US where we're able to quantify pretty much every part of ourselves and our community and our society. We have the ability to understand and make decisions based on an amazing amount of data that were never available in the past. And that's a really exciting thing. It means that we're making new innovations and we're finding and discovering new things, and we're able to share and learn together in ways that weren't formerly possible. And that's really exciting. And it's really exciting for the field of health, especially for community health, because it's an area that is really relied on multiple aspects of information over the years to make decisions and to understand what it is, what community health is, about developing indicators and understanding what are the things that affect people's health and what are the things that we do ourselves to impact our own health. And so we have this really exciting place where open data is starting to provide even more information. And I have to ask the question for us today, is it making a difference, and can it make a difference? Can data alone being released to the public make a difference? And that's what we're going to get into a little bit today. And so it's really important that we understand data in context, and it's really important that we understand what data can and cannot do. So we're going to get some really great examples from our panelists today about what data can do in our communities and for our society. So I'm a former spatial epidemiologist and currently working as a community health researcher, amongst other things. And I think that qualifies me to say that the health sector has simultaneously led and is now lagging behind the curve when it comes to open data. For years, we've published amazing academic tomes of research with huge tables of data, huge amounts of information. And that's quite powerful, but it's also limiting in how it's available and what we can do with that. And so as open data has swept through a lot of government agencies, health has started to lag. And I think we today, collectively, those that are running this conference, share the vision of inspiring you and encouraging you to realize that opening health data is both safe and possible and leads to some amazing possibilities. And so we're going to hear from two leaders in this field as well about what they've been able to do and things that are working elsewhere, and get some great examples. We'll have some Q&A and some time for audience questions. I'm going to introduce both of our speakers at once, and then Cyndy will lead off. Cyndy Comerford is the Director of Planning and Fiscal Policy Management for San Francisco Public Health Department with their Environmental Services Division. And she has been involved in planning and developing programs with a focus on equity and community health for a long time, with a focus on sustainability as well. And these are things that are really important for us broadly because those things are all critical if we're going to have healthy communities. She's been developing research and equity-focused analysis with a team of analysts and planners, and so she understands data very well, but she also understands the application of those data. And she's going to talk about some exciting work here in San Francisco. And then Cheryl has been involved in the public health space for a long time. She's worked with some of our partners in Boston in the non-government sector and in the government sector, and she was the chief health officer for the LA County Public Health Department, and she ran their community health survey in that county. And she's been involved in the health and community indicator sector for a long time. And so Cheryl's going to give us some great examples about what is happening in the open data health sector, something that's very relevant for us here today. So I'm going to hand off to Cheryl to begin with, and we'll have some time for questions after the two presenters.
Great. Thank you very much. I want to start off by saying free the data. You know, whatever we do, let's start this great work. And what does that mean when data are free? To me, it means they're accessible, they're discoverable online, they're machine readable, they're exportable from whatever software houses them, and they're available for innovation. And I agree that this is a really exciting time because we have so many compelling examples of how open data strategies can advance community health. And I've been fortunate to be working with California Healthcare Foundation at looking at some of the trends and the emerging practices that are going on around the country. And I think we can all take these practices and diffuse them in communities where we live and work. Some important trends that have been going on nationally. First of all, sweeping changes in access to data at the federal level and policies that really set open data as the default have been a really important influence. Hundreds of data sets, I think that's up to 300 or so, 30 or 40 APIs and innovative applications have grown out of the Health Data Initiative at Health and Human Services. And not only that, but Health and Human Services has really modeled the potential for public-private partnerships along these lines. We have an expanding health data ecosystem so that more people are using technology and interacting with data in new and interesting ways than ever before. And importantly for today, there's an increased availability of data at the state and local level. And the open data sites and civic technology are really taking on a prominent role in many communities across the country. And principles of transparency and performance measurement and citizen engagement with the tech sector are really providing powerful models for innovation at the local level. So we have the model at the federal level and at the local level. And the challenge now is to learn from what's been done and really grow these emerging practices in our communities. So open data have played a central role in providing better access, faster communication to the public. One example is the Food and Drug Administration of the federal government and its role to ensure the safety of food and drugs and other products. And what was formally released when you had a voluntary recall of a drug or a food product, it was released by press release. And so now that data are streamed via an API so that recalled product info can get out there through a variety of channels. And so people can find the item on their pantry shelf and pull it off. The flu app, which started in Chicago, it started with a conversation between a health department employee and a developer at a civic hack night. And that app basically just tells people where they can go to get their flu shots, including free and reduced priced flu shots. You know, it seems pretty simple, but that app was really innovative and has now spread at least to Boston and Philadelphia and perhaps further. But, you know, yes, people can search for that online and probably find it, and 10 or 12 clicks later, you know, land on a PDF that tells you where you can go to get your flu shot. But why not put that information out in a developer-friendly format to begin with? So another good example is New York City officials. In advance of Hurricanes Irene and then Sandy, made the storm evacuation data, they put it out on the city's data portal in a developer-friendly format. And what you saw was incredible maps of the evacuation zones being created by media outlets and others, taking meteorologic data from NASA and NOAA and combining that with the evacuation zones, so you had really high-quality data visualizations and information for the public at a critical time. And government officials were very quick to note that they could have never done this themselves. You know, so putting it out there meant that they were being as effective as they could be at transmitting life-saving information. In addition to better communication, open data play a critical role as performance driver, and several speakers have referred to this. And the restaurant grades, I think, is a great example of that. And I want to say that looking around open data sites around the country, I agree that health is a little farther behind than other sectors, but probably the most popular data set up on open data sites that's health-related is the restaurant scores. And I think this is really exciting because it can demonstrate a number of capabilities of open data as a performance driver by engaging the businesses and the public into really caring about the conditions that give rise to foodborne illness. And like the food inspection data, many such systems exist to protect our health. And you're all probably familiar with those. The key is that we want to drive comparisons between various health industry players to improve health and promote accountability. And the key is finding the measures that really matter, the measures where prevention can really make a difference. And I always think of healthcare-acquired infections, which are a terrible problem right now. An estimated 1 in 20 patients are infected during a hospital stay. If you think about that number, that's just incredible. And in the UK and in Canada, I believe they were the first ones to really institute some public reporting around hospital-based infections by hospital. And studies definitely in the UK and more recently in Canada, credit public reporting for playing a role in the observed declines in some of those infections. Another really huge practice is journalists. I mean, journalists are grabbing data and doing all kinds of interesting things with it and can really help tell the story for people who care about health. And one example is Nursing Home Inspect. ProPublica has created a really terrific interactive app using data from the Nursing Home Compare, the Nursing Home Compare data set from CMS, and they've combined that with inspector reports. So they have this app that shows you where violations are occurring in various nursing homes. And you can drill down, by any state in the country, you can drill down to the actual facility and see what violations. So I think that has potential to be an important driver of quality care. And not only have they created this app, but they actually then take the data that they've generated and make it available. They themselves publish it in an open format so that others can do interesting things with it. Oh my gosh. So the other area open data can make a difference is really boosting citizen and policy responses to unsafe neighborhood environmental conditions. Later, you're going to hear about the pedestrian injury map, which is a really great innovation along these lines. The Open 311 systems that Jay Nath mentioned. There's a blight status app that I love, which was created by a team of Code for America volunteers went down to New Orleans and worked with city officials there to link together various data sets that were siloed throughout various agencies in the city of New Orleans, and they linked those together so that they could track the status of vacant and abandoned properties in the city. And they created a public-facing app for citizens who were very engaged in that process, the process of getting those properties resolved. So I wanted to quickly mention some of the key elements for success. And then we can talk about it later in the discussion. But one is strong leadership. You really need a champion. And you can see, what a great champion Jay Nath is, and others, chief data officers across the country like Mark Head in Philadelphia, really play an important leadership role. But we're starting to see health leaders pick up that role. Nirav Shah in the New York State was really instrumental in getting their open data site, their statewide open data site up. Bashar Shukair in Chicago both play roles in data and innovation. Second, you need a technical, a content-driven infrastructure, including a well-designed open data site and APIs. Third, policies addressing agency requirements, including timelines for the identification and publishing of high-demand data, and the treatment and preparation of data, guidelines concerning licensing and whatnot. And you really need engaged third parties, which is going to be an ongoing theme of today. This public-private partnerships are really important, as well as engaging journalists, civic hackers, tech incubators. And of course, you need data sets. And I think it's really important to tap the expertise to curate, analyze, prepare, and link the data. And so there are a lot of stakeholders that are really knowledgeable about data and what measures matter. When those change, they really translate to meaningful improvements in health. So those folks are out there. And so I think it's really important to find them. One other quick note that open data isn't always about public-facing apps. I think that well-designed APIs can link data that are locked in closed systems that are really valuable on an enterprise level as well. So maybe we can talk about some examples of that later. Good.
Cheryl.
Yeah.
Go back here. So again, my name is Cyndy. I work at the San Francisco Department of Public Health, and I work in the environmental health section. And I kind of have a dual role within the department. I manage our planning and policy, which is kind of specific to our regulatory programs. And within our department, we have 15 different regulatory programs, and we kind of regulate anything from food safety, which I'll talk about a little bit in the presentation, to hazardous materials, to medical cannabis. So it's a very diverse set of programs. I also help facilitate our program on health, equity, and sustainability. And this group does research and analysis to assess urban health inequities and to provide expertise to help solve these problems within the city. So approximately 2 years ago, our department started kind of experimenting with open data. And our first attempt to kind of get data up online was we got an FTP server, which took 9 months for our Department of Technology to agree to let us have an FTP server. And we were able to get our food safety data up online. And we were also able to get a set of 20 indicators that we use in our Sustainable Communities Index. And we got that information up online, and it was up for about, I don't know, 6 or 7 months, and then our Department of Technology took away the server. And no one actually really seemed to care that our data was gone, with the exception of the health food safety data. And so kind of during this time period, we started to rethink of how we should kind of implement open data and what a process should be. And so today I'm going to talk about just a little bit about our experience as a local health department in kind of our process of working with open data. So the first thing that I think is really important is that working with open data is the data has to be relevant. And as a public health department, we found that starting with a public health concern is really important. And a health concern helps promote the data so we can kind of look for solutions that can help solve the complex problems that are important to our department. In 2002, the CDC released a report basically saying over the last 10 years that around food safety that there's been no progress, that with certain disease agents have kind of remained static and a couple have decreased. And within the health department around our process of doing food inspection safety, we haven't really changed anything in the last 10 years either. Our regulatory capacity has increased that we're now monitoring more food establishments, but our standard operating procedures haven't really changed either. And so we kind of saw this lack of national progress and our lack of internal progress as a really good opportunity to start to work on this issue. And at this time, Jay with the mayor's office and Yelp and also New York City started to propose this open data standard for food safety. And they had asked our department to come on board as a content expert. And we found this as a perfect opportunity to kind of promote an issue we have been having with a third party. And basically, Yelp had this opportunity to take our data and empower customers and show the food safety regulation scores. And we had an opportunity to see if promoting our data through a third-party vendor would help protect public safety. When the city of Los Angeles began to require that restaurants display hygiene cards on their entrance, studies had found that there was a 13% reduction in foodborne illness. And we're hoping to do a study similarly after this data has been up in Yelp to see if providing this data in a consumer-friendly format will help reduce foodborne illness. So in addition, real quick, in addition to forming partnerships, one other really important aspect of data is when you're sharing data with people, they have to be able to understand it. So we went through a very big process of trying to standardize our data. And Jay had alluded to the live standard, which is the local inspector value entry specification that we helped develop. So any type of public health department could format their data so it can be brought into this system. And at the same time as we were doing the standardization of our regulatory data, we also started to take all of our data from our reports and analysis and create a system to format that. So we went through creating a nomenclature system, creating a field names, values, and kind of cleaning up all of our data. And so we were able to clean up over 100 data sets and put them on data SF. But for all of our data, we're not really able to form partnerships with Yelp. We have 100 sets of data. So we're trying to find kind of innovative new ways as we put data up, how to make the public interested. And one way we found is putting up visualizations. The map on the left is something that we created last week. It's an interactive rent affordability gap. And basically, it shows how many jobs at minimum wage you would need to afford a 2-bedroom apartment within San Francisco. And basically, this information kind of put into a different format, just not looking at median rental prices. It really engaged stakeholders. And for us, we took it as an opportunity to raise awareness about the public health issue of affordable housing and how that relates to the potential health effects of people living within substandard housing. And so we were able to visualize this information, raise awareness, and it got picked up by the newspaper, and there were a couple articles written on it last week. And so this is a way of putting out data, but also engaging people with visualizations and be able to promote your public health issues. And so kind of going through our process of looking at open data, we've kind of developed this framework. And I think it's important to people who are about to start experimenting or using public data is to develop your own framework and make sure it's relevant to you. We're going through this process of trying to standardize data, provide visualizations, raise awareness to our important public health issues, and also, when applicable, work with partnerships. And so I'm going to talk a little bit about some of the opportunities and barriers, but I think we'll also have a chance to continue this discussion within our panel. But I'm going to start with the barriers. As a very bureaucratic public agency, it's not, while a lot of this information sounds very basic, there are some barriers that we find. I think people in government often feel like they kind of work in a fishbowl, and that people don't really get praise for disclosing information. And there's also a lot of unwelcome exposure. And so it's trying to shift the culture within our department to kind of see working with open data, how it can benefit our department, and also how you can share your successes as you move with the public. For our department, we've seen an opportunity to be transparent, to engage the public. It's created efficiencies within our own department. We used to spend almost a third of a full-time employee responding to ad hoc data requests. And since we've gone through this process of cleaning up our data and putting it online, we no longer have to support that function for that position, and we can spend more time doing research to kind of address these complex health problems. And so I'll turn this over to Steve, and we can continue this discussion.
Thank you both. I think that, let's get a round of applause. I think Cyndy's last point hits home for me as well, is that within our staff, we would spend an inordinate amount of time digging up data for projects and responding to public requests for basic data. And by us choosing to publish our data, it meant that we could actually enable other people to have access to data. So the difference, just imagine the difference when you get a call from someone that says, I need this, can I get it, can I find it? And maybe we don't have the resources and maybe that's too hard. Instead, being able to say, sure, it's online, just go and get it. It's such an amazing thing to be able to just simply refer people and they get what they need. It's a big deal. But it also means that we can use our analysts, which are trained to actually think and analyze instead of digging up basic data. So it's a big difference in the quality of work that we get from our staff. So I wanted to start with a question for Cyndy. this seems like a really exciting opportunity to blend and make real this concept of, we hear a term a lot, public-private partnership. Can you tell us a little bit about, does it seem like this is something that there can be more of, and any vision you may have for being able to enable more public-private partnerships within using and accessing health data?
I think so. We talked about the example with Yelp. We're also working on creating an open data standard for our housing data, and we're working to kind of partner with a third-party application around the real estate market. We're looking at making our health code violations public for housing, and we want to see how that could be used with maybe like a Trulia or a Craigslist to kind of promote healthy housing. One of the things I do struggle with is that not all of our data is meant for consumer applications. A lot of the data that we have, we want to use to kind of solve complex health problems. And so how to engage partnerships to work with us to do that, I think we still need to figure out solutions to do that.
Yeah, there's definitely a big difference between apps that make wealthy people's lives better and cooler, and uses of data that actually change people's lives, and that's a very important difference, and we're now getting to there, I think. Cheryl, I wanted to ask you, you mentioned you've seen a lot of cities and what they've done to achieve some success in opening data. How can this happen without strong internal leadership? It seems like there's always an internal figurehead that's willing to take a few risks and push this. How does it happen, and has it happened where there hasn't been strong internal leadership?
I think one way that it's happened is that organizations have figured out what data are important, what they're already disseminating, what they're already sharing with the public in different formats, and then just trying to make those available in better formats. The other way that organizations start really is by cataloging what they have, and then figuring out what are the most high demand, high value data sets. But the leadership really is important. I mean, you need some kind of champions, and it doesn't really have to be the leader at the top. I mean, the champions can be throughout.
So it's one of those cases where the policy doesn't happen without the people first, right? So it's not a policy issue; it's a people issue.
Yes.
So given that answer, can you each give me 2 data sets that you would suggest if a city or a health department was out there that was looking to maybe play with this open data thing and get some early wins? Obviously, you've done this. What would you recommend as 2 easy data sets that would be a good starting point, the low-hanging fruit for people to say, we're going to release this and see what it can do? And you've already done this, so 2 pieces.
I mean, I think it depends on what type of agency you are and really what data is relevant to you and what you have the capacity to raise awareness with. We started with the food data, and now we're working on housing. We're developing open standards for both data sets, so I think those would be kind of easy markets for local government agencies to enter in, since the kind of groundwork has been established already.
Yeah.
Cheryl, do you have any perspective?
Well, I think the restaurant inspection data is great, since so many are doing that anyway, and then bringing that into the live standard. It's a tough question. I think that some of the emergency preparedness information would be really important. One local health official said that they go and set up this capacity to deliver prophylaxis to a broad number of people in the population, and having that information ready to sort of release, I think would be a really effective way to communicate. So any data set that you really want to communicate. The other place to start is community resources that, never publish a hard copy resource guide again. Just do all of that online.
Amen to that. Okay, so we're at the end of our panel time, and am I correct in understanding that means we have 5 minutes for audience questions? Oh, we have plenty of time.
Okay.
So I have a structure here that's a little different. So I'm gonna spend another 5 minutes talking with our panelists, and then that leaves us a lot of time for audience questions. So yes, that's correct. Awesome, perfect. It's always good to have more discussion than run out of time for discussion. So I have a couple more questions I wanted to get out, and then we'll open it up. And there is a microphone over here, standing alone. Maybe I'm not sure if that one in the middle's turned on. So in a few minutes, definitely if you want some questions, that's where you'll need to be. I was curious if either of you had seen any opportunities or experience instances where surveys have been considered and opened as open data. Often when you do a survey, you've got a lot of confidential information, and that's often a trickier thing to release. But have you seen any instances where community surveys have been released at a very, very precise level of detail that doesn't just say, here's the data for your county, that's great, what about my neighborhood? Have you seen that happen at all yet, or do you have any thoughts on how that can possibly happen?
I haven't seen, there are a lot of community health assessments that are done on a county level around aggregated data on a zip code level, which is publicly available. But I haven't seen survey data down to the point level. I mean, we get it kind of with individual patient level, or there's kind of protections, and it's kind of difficult to release that kind of data at that geographic scale. Most of the data that we work with in the environmental health section is either looking at social determinants of health, so it's population level data, or working with establishment, regulatory establishment data.
But I'm really glad you brought that up, because it's a huge area of need. Chicago does release some of their survey data, I think it's New York. I'm sorry, New York is doing that. Chicago is planning to. They release some of their community health survey data, as low as they can get, and the indicators that they would release would depend on how robust those indicators are. And they can only drill down so far for various subgroups. But the Institute for, I'm probably going to butcher the name, the Institute for Health Metrics up at the University of Washington in Seattle is working on some really interesting methodology around surveys to try to generate small area estimates. And that would enable data to be released at a very local level that are fairly reliable. Ali Moqdad, who is formerly from CDC, is actually at the Institute now and working on this. And so you can go online and read about it, but I think that something like that has a lot of potential.
So, Cyndy, you mentioned that engagement was starting to become a big factor for you. And it seems like there's this, I'm going to steal your slide, by the way, on that cycle of engagement and standardization. It seems like there's a necessary shift when we start, often the open data movement starts at it did start within the open government transparency movement, and it's broadened and grown from that, and it's now its own thing that has roots back to transparency and open government, but is obviously much, much bigger because it means more different audiences. But I'm just curious, when we have this push for open data, and people want to release data and people want to get the data out there more, you alluded to the fact that you are now engaging through that. How do you see the roles that need to change within government organizations to deal with the fact that just publishing the data doesn't make change happen? How have you seen, or in an ideal scenario, what would it look like for you in a few years to really be able to effectively engage with your communities through the data that you're publishing, both locally and then, Cheryl, for things that you've seen elsewhere as far as how this can, what the possible changes will need to be in our staffing to really engage through the data?
I think on a local level, it's a pretty easy process. It's when we're working on something or doing research that we promote the open data at the same time we're promoting our research, our assessment. I showed the affordable housing instance, and I think what we do is we just have to plan to do these open data releases that correspond to important public health information that people find interesting. And we're hoping that by promoting this data that we'll find external partners to work with and kind of engage them in these health problems to kind of find different ways of displaying the data or different solutions.
I almost want to talk about some of the barriers, because I think that's really what has to change. There's a lot of cultural change that needs to happen. I think data ownership is a pretty tough problem. And I understand it, because when you work on collecting data, managing it, analyzing it, taking care of it, you feel very protective of it. And that's a natural instinct. But I think, as Cyndy was talking about, people can come to see that differently. We can share the successes and actually increase the value of that information by using it in multiple different ways. Another thing that really has to change is proprietary agreements, and in some cases, state policies that really limit the ability of local areas to use their own data. I think that happens a lot. And just, I think the culture of constrained sharing needs to change. Oftentimes you'll get, well, we publish the data, it's there. We have a query tool, but, that's, I think, different, and it's just a conversation that has to happen. And I think the more collaborative, the better, the more, that we continue these conversations, the better.
So on that note, how many people in the audience have ever hit a government website trying to find some data and found a query tool that didn't quite cut it for them? That could. Hey! And how many of us have built those things in the past? Yeah. Shame on us. Okay. I have one more question. I think to give us all credit in the health sector, I think this is an area that we lead in, is that we lead with engagement. We've known for a long time and done for a long time the practice of it's not enough to put a report out. It's necessary for us to now engage with those communities. Otherwise, the report will sit on a shelf somewhere and mean nothing. And so that is an area, I think, where health has led for a long time, is that we've been very connected to our communities, and we need to continue to show by example that we can do both open the data and also engage to have an impact as well. So my last question before we open it up, and feel free to hit that microphone now, is do you see open data in the health sector as leading towards the push for open science and open research, or do you think that they're going to be very separate fights and they're not going to really lead into each other? So the idea of opening science and opening research that is public for public access, no restrictions, no access fees to journals and the like. Is this connecting it all into that space, or is it going to branch off in somewhere disconnected?
I mean, I definitely think there is a connection between the research space and the public health sector. And I think we are seeing instances of where they're merging. And I think it's really important. One of my goals within the health department is to start an open data working group where we kind of merge the researchers, public health practitioners, epidemiologists, and get everyone together to see how we can promote this data. So I think creating collaboration within the health space with these different disciplines can kind of help move that space forward.
Yeah, and I think the more that we can point out where open data and even sharing data, linking data have really made a difference in being able to turn out a particular analysis, the better. So just by highlighting those examples and really helping to promote them.
I think the concept that Cyndy alluded to then is often referred to as the long tail of government. So we have all these paid government elected officials, we have a bunch of government staff and bureaucrats, but then we have all these experts amongst our community that actually know a lot about data or community health and whatever. But by engaging them, we can actually leverage their resources, their knowledge. But as soon as we just publish and leave it there, then we refuse to accept the value that our community brings to understanding our processes and our struggles. And so I think that's a really important point that I've definitely had a lot of inspiration from San Francisco, City and County government over the years that have done this well. They've engaged with the rest of their community broadly. So I want to hand it over to our audience, and I see Carla's already prepped. Awesome. Step up to the mic, my friend.
Good morning. My question has to do with, I'm a civic and social innovator. And I come up with things with data, and my team does, and then we go to hackathon or whatever, and you'll win it, and then you'll figure, like, how do you engage from winning the hackathon to actually working with an agency inside government to actually get that piece of technology built out and deployed?
I can answer if no one else does, but
Since I've never been to a hackathon, that would be great.
So last year, I founded an organization called Open Oakland, which is a civic innovation organization designed to do largely just that, as well as make government more open. An app got built at a hackathon last year that we helped to run, and it was about the city government budget. And it was never possible to see the budget. And you build a piece of tech, and then you get excited, and then you win a prize, and you go away. And we provided a weekly hack space in City Hall where people could come and work and talk together. We provided access to city staff so that the city staff could advise on the development of that tool. And then about a month ago, we launched openbudgetoakland.org, which for the first time allows residents to see our city budget and understand it in context for the first time ever. And so it takes consistent engagement from city staff, and it takes a consistent, reliable place where you can meet and grow a community of developers and hackers that actually care about those things. And so it's basically creating an ecosystem for civic innovation. So that's one way to do it.
Because what I'm mostly talking about is like our team, coming out of the hackathon, we're like trying to engage the different city, the different city agencies and be able to work with them on figuring out, did we actually answer that pain point? How do we actually work with them? And so it's mind-boggling, and I've met with other folks that have won hackathons, and we're all struggling with, now there's like a missing bridge, and creating that bridge, is there something being done to create those bridges so that we can actually see the benefits of these different hackathons and innovation days?
I think this is basically echoing what you said, Spike, about working with organizations that are working with community groups, engaging the nonprofits that are sometimes working with both the government officials as well as the community groups might be a good way to make inroads.
And there is a hardness to this, is that without a person having interest and being willing to commit to beyond their job description, then these things become really hard. And we've been lucky in Oakland, we've had some city staff that have been really interested in engaging and supporting. Without that, this gets very, very hard to actually do what you're trying to do there.
Mm-hmm.
Next question.
I was interested, I've been at a couple of meetings lately with people who have really valuable, great data. And you kind of alluded to it in passing, the problem of visualizing the data. And what are some successful models for data design teams to engage with the data, or with the right people to make things happen, so we don't have data visualizations online that we can't understand or use?
We've been really successful with using interactive mapping. We have a team of geospatial experts, and so putting out interactive maps have been one way to engage the public. Also, we've been fortunate enough to, for the last couple of months, to hire a communications specialist, and she's really helped taking our information and making it visually appealing to people. And that's something that, as many health departments, we don't have really the capacity to do. We're data analysts, we're GIS experts, we're epidemiologists, but we are not communication specialists. And it's something that we've struggled with for a long time, but we've had a communication specialist, Elise, who's in the audience, and we've only had her on board for 3 months, and we've seen such significant progress, and I would recommend that to anyone.
Yeah, I'd say again, this is a space where you can engage with your community broadly and utilize the resources there, because you're probably doing work that's interesting to a lot of people. And there's definitely, that was our rationale behind Open Oakland, is that there are people with skills and interest, and we can tap that and support that organization, those community members, to do things that matter. And so there are great designers out there that have an interest in improving things. But that also hits the job description issue, is that we've never invested in good communicators and designers in government, but we've now realized that good design and communication really matters. And so that is a hard thing, but that's definitely where I would reach out to my community and say, we have these data, these issues, come and help us work collaboratively on this, and let's see what we can do. Let's bounce to this mic first.
Great, thank you. First of all, thank you for great talks that just kind of stimulated a lot of ideas. A question, a comment. The question really has to do with whether or not there's any culture change around what data is getting labeled as, quote, sensitive. One of the things we often struggle with is that culturally, some people think mental health data is sensitive. And people think that sexual orientation data is sensitive. And often the numbers are there, so we really aren't worrying about privacy and confidentiality, but it's kind of a cultural sense that those things aren't talked about. Now, we know that in Healthy People 2020, one of the things we're about to see is that there is now a focus on the concept of well-being and a focus on quality of life. And so it would be great if we could start to see within public health more of the focus being on emotional well-being and indicators of like happiness, life satisfaction, et cetera. So I'm wondering if there's any thoughts about, kind of in public health, kind of moving towards some of the more joining in with the mental health side.
Yes, I do think that we're headed in that direction. In a couple months, I think from our department, we're going to start working on community resiliency indicators and how we create resilient communities for disaster preparedness and for climate change. And I think mental health is a really important part of creating community resiliencies. And again, our model is as we create these indicator systems, we will have all of this data online. To speak to the sensitivity of the data, I think that is something where we do need a huge culture shift within public health. I think during my presentation, I kind of brushed over the barriers and the obstacles, but it is a major shift to get people to release their data. As Cheryl alluded to, researchers like to hold on to things, but in our experience, that doesn't really foster use of the data or solve problems. So for people to see how these partnerships can help kind of engage people, I think is really important, and to kind of, I think the sensitivity of the data is something that we're going to have to work on within public health to bring awareness to, and an obstacle that we'll have to overcome.
Yeah.
On this lady over this side. We've got a few minutes left, so.
Well, sort of piggybacking on that. So HIPAA Omnibus says that research data, genomic data is now protected. And you're looking to providers, healthcare providers, to give you their data. What's your vision for how that works? What's your vision for connecting the public sector and what you have now with what's happening at a private institution, a hospital system, an academic medical university, et cetera?
Well, I think that I think data that are reportable by the private sector would be a potential opening to start for open data. If they're required to submit, patient satisfaction data or other various metrics, perhaps that could be shared. The example of the infection reporting, the combination of mandatory and voluntary reporting about hospital-acquired infections, I think would be a great start. There are other metrics of quality of care that I think would be really meaningful, and I think if there were, my vision would be that if we could all agree around 5 or 1 or 2 to start with, where everybody would actually decide to contribute, I think it would be a huge step forward.
Okay, thank you. We have one last question here. Well, really quick responses, and we'll get both of you in a very quick time, so go quick.
Okay, I just wanted to very quickly respond to a couple things. Last week, I was lucky enough to give testimony to the National Academy of Science on the new open data Obama policy. And my understanding of it was that it's more research that's federally funded. So a lot of the speakers were around academic research and how that was going to get opened up. My advocacy was more for the grants that have been federally funded and that also are full of information and we need to have access to.
Agreed.
Taking off from that, I was the prevention director for 8 years for Santa Clara County.
Ma'am, we're out of time, so can we get a quick question? Or?
Yes, I do. How do you use data and the technology to transform it into innovative program design that actually becomes part of the authorizing environment that affects communities?
That's a fantastic question, and there's no way any of us can 30-second respond that
It is a
and
good
do it
question.
justice, but that's a big deal. And I'm talking about that tonight at the Ignite session, so come along for that. Very quick, last question, we'll try to respond.
I'm a healthcare journalist in California. I'm constantly trying to get state government data on health issues such as hospital infections. At this moment, California budget is still very bad. Essentially the data mechanisms they have are outdated and they have no staff. Do you have any quick comments on how we could deal with that?
When we're broke, we have to be smarter. That's all there is to it. We can't fix things when there's no money, so we have to be smarter about using what we have. Police departments are the same, healthcare systems are the same. You can't fix things without money, so you have to be better with what you have. It's a really hard reality, and everyone says they're facing the same thing.
Right.
Some places are just changing how they do things, and some places are reaching out to their community to be involved.
Yeah, I mean, we don't have any dedicated open data resources. We've looked within our department of people who were interested in pushing this field forward and have worked to kind of remodel their jobs where this is incorporated into what they're doing.
All right. Well, I want to thank our panelists and thank you for your questions. Thank you for your input and your perspectives.